I'm the medical director of Child and Adolescent Services at the Medical Center of Aurora, the largely non-publicly owned psychiatric hospital in the state. Here I'm an inpatient psychiatrist with a front row seat to the emerging epidemic of cannabis abuse and addiction that threatens to swallow the lives of a whole generation of Coloradans. On our adult inpatient unit, it's hard to keep count of the number of psychotic and suicidal patients that are admitted with THC on board. And regardless of the data or clear evidence of how cannabis contributes to their illness, person after person refuses to accept that marijuana could be bad for them. How could it be? They have been taught to believe this is a harmless plant, a medicine that is good for anything from headaches to cancer to anxiety. It's natural, without side effects, without risk of addiction. This is the lie that is ruining the lives of far too many people in our state. The story on our adolescent unit is even more tragic, as we repeatedly treat kids too psychotic to know what's real, who they can trust, or where they are. The rates of adolescent psychosis have grown steadily since legalization, and in almost every single case is linked to the use of high THC potency concentrates. Products known as dabs, or wax or shatter, that are made in a lab by distilling down the most psychoactive component of the marijuana plant and concentrating it into what is better described as a hard drug than the weed people voted for in Amendment 64. Kids as young as 11 or 12 are using blowtorches and glass rigs to smoke these highly addictive and harmful chemicals, sometimes every night just to go to sleep.
As many of you know, I have a son who started smoking marijuana in the 8th grade and then smoked marijuana consistently and persistently all through high school. And at age 18, he had his first psychotic break. And we did not know what the cause of that was, but during that time, before that happened, we had tried everything in our power to stop his marijuana use. We sent him to psychiatrists, to therapists. We grounded him, we drug tested him, we punished him, we praised him for the things that he did do, but we couldn't stop the use. Everywhere he went, this product was available and in greater and greater concentrations and potency. And after his first psychotic break, we sent him to a hospital where he spent 6 weeks, and it cost us $60,000, and they didn't fix it. They couldn't fix it. Today, he has schizoaffective disorder with co-occurring substance misuse, and he will never recover. And our family is broken as a result, and we will never be made whole. So let's not talk about him today because it's too late for him. Let's talk instead about your children and the thousands of other children that are being negatively impacted by the use of marijuana. It's a real thing. And let me just say that hundreds of parents, thousands of parents are being affected by this. And we are done being blamed and shamed into silence. We will be silent no more. And this bill gives us a voice. It says, yeah, we have to look at this. This is on us. This is what we were sent here to do.
The rise in teenage use of high THC concentration marijuana is a critical public health challenge. It demands action, and it's important what's being done today. It is a model for the nation. Just consider the latest report from the Colorado Department of Health, Public Health and Environment in their Healthy Kids Colorado survey. They surveyed the use of dabbing, which has been discussed, a way of accessing high THC potency. It went from 4.3% of students in 2015 to over 20% in 2019. This is an alarming rise,